Welcome back. We promised you that Dr. Jeremy Boethin was going to help our nice colleague here, John Hammarley. He can't talk much, don't worry about him. But so what are you going to do to really help relieve some pain for him?
So the first thing we do is we always want to figure out where we're going to adjust. We just don't grab people and start moving bones around unless we know where to do that. So
sounds like good practice.
Yeah, it's a good place to start. So I always start at the feet. Just take a peek at John's leg length here. And he's a little bit short on the left, and as I look up his left leg, his left hip's pulled up. In his mid-back, the left ribs are pulled up. I can see his right ear, and I can't see his left ear. So I know we have some work to do. So we're just gonna look at the legs, then I come up to the pelvis, get my hands on his hips, and as you can see, I'm on the same spot on each part of his pelvis, right side, left side. Left side's tip back, right side's push forward. That explains the short leg.
Yeah.
So definitely going to adjust here.
What are you feeling for there?
And here I'm feeling just for my middle fingers on the vertebra as I slide down. My other two fingers are right on the muscles. I'm feeling for muscle tone, temperature changes. He's definitely tighter here. This vertebra is more pronounced in comparison to the ones above and below it. Same thing through here. So we're going to adjust these guys as well. Then I'll come up to the top here at his neck. Typically with the left short leg, we see some changes of how the head sits on the spine. He's tipped, his left first vertebra is pushed to, or his first vertebra is pushed left here. Head's tipped down on the left as well.
So you're really feeling your way through the entire body to see exactly where you need to be adjusting. It's not just a...
It's not willy-nilly. No. There's a method to the madness. So then I just recheck. Sometimes just touching the body will change how the body is set up. And I can already see his pelvis starting to level out a little bit. So we're going to get busy with some adjusting now.
Cool.
And so, John, let's have you lie with your left side up, please, if you would. Try to make you as comfortable as possible, sir. I'm going to bend this knee. This one goes straight.
Can this kind of an adjustment help anyone, or is it just someone who comes in with a lot of pain?
Both, yeah. I mean, when you adjust the spine, it affects its motion, it affects how the nerves communicate to the body, and everybody's healthier when the brain's better connected.
Could people come in just literally for like a tune-up kind of thing?
Yeah. Stop talking, let them adjust.
All right, you good there, sir?
Yes, sir.
I'm gonna bring you all the way over. And if you'll just let that hip relax, we're gonna put a little drop through here. Good. Have you go to the other side, please.
Nice work.
So have you move around there. I'm gonna stand where you're standing.
That sounded good.
Release.
Here we go.
And a little bit different on this one. Actually, John, I'm going to have you straighten this leg. Right to there. I'm going to straddle it. I'm going to let that hip come through. All right, let your body relax. Bring it around. Good motion. On your back, please, if you would.
Hopefully everyone's taking deep breaths with us at home.
Feet on the table for me. This is where you get to love yourself. Give yourself a little hug here.
Eat your heart out, Mackenzie.
Oh, I am, trust me.
Roll you over here to those spots we found earlier. Right here, big deep breath in for me. All that air out. And on this one, I'm going to curl you up.
That's what we like to hear.
Lift your head up for me. Let all that air out. I got you. Good job. Now for the big finish. So you can probably see this, Mackenzie. Here's my fingers are on his skull. You can see the left side's lower than the right side. So we're going to move this joint for him here. Let your leg relax for me.
How long does an adjustment usually take? Is this a quick one, or?
This is pretty standard in our
Pretty standard?
office. Sometimes they're quicker, sometimes they're a little bit longer. But
And when people come in, is it almost an immediate
change for
immediate
them?
relief for them when they leave?
Let me help you out.
I guess we can see by John's face.
Everybody responds a little differently.
I feel about 3 inches taller, honestly, especially through my neck.
Yep. Your head's
I have
on
a
straight.
tendency to do this. looking at the computer all the time.
We all do. Yep.
That was
Good deal.
impressive.
Thank you.
So if people want to come in, where should they get a hold of you at?
You can find us on the web at lifestylechiropracticllc.com. You can call our office, 541-617-9771. We do complimentary consultations. We'll talk to anybody about, I don't care, whatever it is. Bring it to our office. We'd love to just chat with you about your health. So,
okay. Thanks so much.
You're welcome.
We appreciate
Thank you
having
guys.
you here.
Hammer time.
Thanks, man.
You're welcome. Thank you.